positivity rate statewide. And we have 10 counties that are at least 15% or more, and a few are even higher than 20%. So just like you've seen in the past, when you have that increase in cases, when you have that increase in positivity rate, you're going to see a commensurate increase in hospitalizations, and that's certainly what we've seen here. We were under 200 hospitalizations statewide, and now we are well over 500 statewide. So certainly going in the wrong direction for hospitalizations. Now, we haven't seen an uptick yet in deaths. Unfortunately, that will probably come in the next few weeks. You're familiar with that, what we call a lagging indicator, which means it takes a few weeks after somebody gets sick and then in the hospital, if they are going to pass away, that will come a few weeks later. So it would not surprise me at all if we didn't see an uptick in that in the coming weeks. The thing that I want to remind you of is that in almost all of the cases of severe illness, so things that are resulting in hospitalization and death, almost all of them are amongst the unvaccinated. You heard Dr. Walensky with the CDC say in the last several days that this is becoming a pandemic of the unvaccinated. And that is also our experience here in Tennessee. About 97% of all of our hospitalizations and 98+% of all of our deaths are amongst the unvaccinated. Now, that also brings up an opportunity to talk about breakthrough cases, because we're starting to see some of those as well. And to define a breakthrough case, that is when you have an infection after you've already been fully vaccinated. And let's keep this in perspective here. We never expected this vaccine to be 100% effective. We were shooting for, or we were expecting kind of 92 to 95% effectiveness. We're actually seeing much, much higher than that here, but there are some cases. To date, we are aware of just over 1,000 breakthrough cases, and that means people who are fully vaccinated, they have subsequently tested positive. And of those 1,000 or so cases, we've had 195 hospitalizations and 27 deaths. Now, I think it's important to recognize that there are a couple of interesting features amongst those breakthrough cases. Almost a quarter of them are asymptomatic. So we know that when people get vaccinated and then they become infected, they are less likely to be seriously ill, and some of them have very mild symptoms. But what we also know is that the people who are becoming more seriously ill after being vaccinated are ones with a likely compromised immune system. And for us here in Tennessee, over half of our breakthrough cases have been in people age 60 and older. We've talked about that for several months now. We know that as you age, your immune system gets less robust. And so we still have people that are in those high-risk categories in the elderly population. They're the ones most likely to have breakthrough cases, but fortunately, the vast majority of them are not having serious illness. Now, when we talk about this increase in case count, we naturally have to talk about the Delta variant. I'm sure all of you are very familiar with the Delta variant. It is the strain that has a lot of numbers attached to it, but originated in India and was formerly known as the India variant. We now call it the Delta variant, and it is here in Tennessee, and it is widespread. Now, I do want to mention a couple of things that may have piqued your curiosity when you talk about the Delta variant. I'm going to pause because somebody has shared their screen.
Alexander, please stop sharing your screen. Thank you.
Thank you. So I want to tell you a little bit about, give you a little context about how we detect variants here in Tennessee. And that's something that you might hear us talk about, viral surveillance or variant surveillance. And what that means is all of the testing required to identify a variant is, it takes a special kind of lab, and it takes quite a bit of time to do that. So we don't test, and it's not unique to Tennessee, this is all labs. We don't test every sample to see if it is a particular variant, but we take a subset of the samples and send them to these special labs that do the variant testing. And so there's a good bit of backlog for that. So what you're going to see on our website is the raw number of alpha variant is going to be higher than that of delta variant, and that's okay. That's because we've been testing for alpha variant longer. That delta variant will continue to grow. We do believe that the delta variant is the predominant variant in Tennessee now. while we don't have exact numbers on how many of all of the samples in Tennessee have the Delta variant, we do know that it is a high percentage. I suspect that it is likely approaching that of the national penetration of that variant, which is close to 80%. With all the variants we've seen, they've been pretty similar. Our experience has been similar to that of the nation. And so I expect that the majority of the variants or the infections here in Tennessee are the Delta variant. Particularly, the Delta variant has a stronghold in the Memphis and Shelby County market. That is not surprising to us, given the outbreaks that are currently occurring in Missouri and Arkansas, and proximity of our West Tennessee citizens to those borders. That does not surprise us at all. What we know about the Delta variant is that it is much more highly transmissible than other variants. Another way to say that is it's more contagious. What we're not sure about, in fact, there's some mixed reports that whether or not it's more virulent or does it make you sicker. Initially, we thought maybe it did. Now we're thinking maybe not so much, but we do know for sure that it is much more transmissible or contagious than the other variants. Bottom line, vaccine is the #1 way to protect yourself against the Delta variant or any of the variants, and the vaccine is still highly protective against the Delta variant. For those who are unvaccinated, they need to continue practicing those, what we call NPIs, non-pharmaceutical interventions that we've talked about for several months now, wearing a mask, keeping your distance, and of course, everybody should be washing your hands frequently. So I want to update you on some of the things we've been doing for vaccine effort in general. I know there's been a lot of discussion and conversation and frankly some misinformation floating around over the last few weeks about what the department is doing for vaccine in general. I want to reassure you that the department's commitment to immunization is completely unchanged. We have always been, not with COVID, but with childhood immunizations, always been one of the best childhood immunization states in the nation, and we want to continue that. Related to COVID vaccination, it's widely known that we have had lower uptake than other states and have experienced a good bit of vaccine hesitancy. You'll remember that we did some market research, both qualitative and quantitative, back in the late winter, early spring, and that really helped us focus our messaging on those hesitant populations. I'll talk more about market research in just 1 minute. But vaccine efforts here in Tennessee continue. We gave over 60,000 vaccines just last week. We have seen an interesting shift, though. The vast majority of immunizations now are being given by private providers, so physicians, doctors' offices, clinics, pharmacies, whereas initially they were mostly given by public health. Now they are mostly in the private provider space. We do continue our outreach and have launched a couple of things recently and have a few new things coming in the next few days. Our Give It a Shot campaign continues. That goes through November, and so you'll continue to see those. And we will also keep going with our efforts to get to the vulnerable populations, minority populations, homebound individuals, basically anybody that has barriers to vaccination. And if they want vaccination, we want to get it to them. We unveiled a new spot yesterday in partnership with the Tennessee Titans. I think you'll find that entertaining, so I encourage you to look for that. We've got several back-to-school vaccine partnership events with schools coming up. I think we've got some as early as Monday and Tuesday of next week, so you will see some of those being advertised. And then this weekend, we have a very special partnership with the Special Olympics where we are providing vaccine on site for them. So those efforts continue unchanged. And then finally, I do want to address the mature minor doctrine. As I mentioned there, I want to stop just a second and go back because I forgot to mention one thing about market research. I told you I would tell you, and I forgot. We are going to do a second round of market research in the fall. That is something that has been very useful to us. And so you remember the report that we put out at the conclusion of that market research that talked about the specific reasons for hesitancy. We're going to do a second round of that market research in the early fall to see if those attitudes and perceptions have changed, to see if there are new ones that we need to address. And we found that research to be very helpful to us. And at least for my purposes, I think we're the only state or one of the only states that have done that broad based market research. And so we'll be doing that again, and we will adjust our efforts accordingly. So sorry, I forgot to tell you about that part, but I do want to address the mature minor doctrine, which there's been a lot of talk about recently. I will remind you that all of the pause that we have taken over the last few weeks has been about communication and marketing. We have not slowed down our vaccination efforts. And as I just mentioned, those efforts to promote not only COVID vaccine, but also all childhood immunizations do continue. The reason that we paused is because we wanted to leave no room for interpretation about where we are shooting. And we are shooting to get the message to parents. And there was a perception that we were marketing to children, and that totally was against our view about the importance of parental authority. We strongly believe that parents are the best decision makers when it comes to medical decisions for their children. And so we took the pause to look at our marketing materials, to look at our flyers and postcards and all of the other public-facing materials to make sure they were appropriately directed at parents. And finally, I do recognize that there is some significant interest in some recent personnel decisions. Before we get to questions, I want to let you know that all of the details of that are publicly available. I'm sure you've all seen them by now, and I will not be commenting further on the specifics of that, but I just wanted to set that stage before we get to questions. Sarah, I'm ready to take questions.
All right, thank you. We'll start with Kelly Roberts with WMC in Memphis. Kelly, if you'll unmute your microphone, please.
Hey, thank you. Dr. Piercy, I have two questions. One is regarding your comment on the 10 or so counties with at least 15% positivity rate or higher. Do you have a list of those counties, or can you tell me, are they in a certain area of the state, metro or rural? And my second question is dealing with back to school.
Sure. So on the counties with high positivity rates, I don't have that list in front of me. Based on my memory, they're kind of scattered throughout the state. Many of them were rural counties. I believe, I can't be certain, we'll follow up with you. I believe that may be in our critical indicators report, but we can get you a list of those counties if you're interested. Some of them, I believe 3 of the 10 actually had rates over 20%.
Okay, thank you. I'll take a look at that too. And just my second question is about back to school. Some Shelby County superintendents had possibly expected some guidance from the state health department. Does the state health department have guidance for K-12 school settings, especially when it comes to vaccinations of staff and students and masking? Thanks.
Yes, ma'am, we sure do. And when the CDC put out their revised K-12 guidance a week or 2 ago, we took our guidance that we issued last school year and are incorporating the updated CDC guidance, and we'll be releasing that, putting it on our website pretty soon. I have finished reviewing that in our department. We sent it over to DOE to make sure they were okay with it. They've provided a few comments and clarifications back, and so we're working on those. Expect to post that probably at the first of the week, if not sooner. I will tell you, it's not substantively different as far as the state's guidance goes. We have some links to CDC guidance, but the state guidance as a whole is relatively unchanged.
Thank you. Next question is Brett Kelman with the Tennessean. Brett, please unmute your microphone.
Good morning. 3 quick questions. First, the CDC has estimated that approximately 83% of new infections are from the Delta variant. I'm curious if that estimate carries through to Tennessee or if there is our own estimate here in the state. 2, I know the department has said repeatedly that the whole purpose of its vaccine outreach pause was to reorient its messaging towards parents. If that's the case, what was the point of instructing staff to remove the Department of Health's logo from all public vaccine information? And 3, Dr. Piercy, it's been widely rumored here that you are currently on vacation in Greece. I was curious if you could confirm or dispute that.
Sure, I'm happy to address all those, Brett, although you might have to remind me. So I think the first one is about the 80+% penetration of the Delta variant. We do expect it is pretty similar to here in Tennessee. That's why I was talking a little bit earlier about surveillance. We don't test, and no state, to my knowledge, test every sample. And so they take a representative sample and extrapolate that out. That's what we're doing here. The CDC tracks that, and we are quickly approaching that 80% mark. I don't have any reason to believe that it doesn't, so we will assume that ours is pretty similar to the nation. I think the second one was about our logo. You are correct. We did remove our logo from some flyers, particularly school-based flyers, until we had time to reassess those. We have done that now. In fact, I just approved a flyer yesterday that has our logo on it. And so we just wanted to be extra cautious in the short term to make sure everything that has our logo on it was messaging appropriately, just as we intended to. Now that we have assured that, we're putting our logo back on things. And then finally, I did enjoy a very nice week-long trip with my family. As many of you probably have experienced the same, it's been a couple of years since I've been able to travel with my family. I enjoyed that, and I got back on Wednesday night, and I'm in Gibson County today.
Welcome back.
Thank you.
Thank you. Our next question is to Tosin Fakile. I apologize if I've not said that correctly, with WSMV. Please unmute your microphone.
Thank you, Sarah. It's Tosin Fakile with Channel 4. Hey, Dr. Piercy. So just a couple questions for you. The first is, if you can talk about what exactly is behind all of this with Dr. Fiscus and just the whole thing about vaccines in the state of Tennessee. Is it anti-vaxxers? Is it, legislators? Like, what exactly is driving all of this? My second question is, why fire someone who was just doing their job based on something passed by government? That's the mature doctor. And why fire someone who was just doing their job based on that? And my final question is, with the numbers going back up, yesterday I spoke to Representative Reagan. I asked him if he was vaccinated, and he said he wasn't going to answer that question. Do you think lawmakers coming out and saying that they did get the COVID-19 vaccine, do you think that'll help uptake in those counties where people have refused or are hesitant about getting the COVID-19 vaccine?
Sure. I may have to rely on you to help me remember some of those questions. So I'll address the one about the personnel decision first. I really don't have much to say other than what is in the publicly available documents. The governor empowers all of us in his cabinet to make hiring and firing decisions based on his vision. And it is my job and my responsibility to make sure that the policies and the personnel within the department are operating in the course of his vision and in our belief about the appropriate role of government. So as far as any other details, you can refer to the publicly available documents there. I think the first question you asked was about sort of what's behind this and where did this come from. So you will remember back in mid-June when the Department of Health was asked to come to Government Operations Committee. We were met with quite a bit of resistance on, or feedback, I should say, with how we were addressing vaccine in minors. And while it was never the intention of the department to target minors, and the department felt that we were educating, over the course of several conversations, not only in that committee hearing, but afterwards, it became pretty apparent that the legislators felt that we were targeting children in those marketing materials. It's my view, and it's not just my view, I mean, it's just fact. Legislators represent the will of the people. And so we really took that to heart when we thought, if they are this passionate about this issue, then they are representing the people of their districts, and we need to listen to that. And so, again, while we never intended to target children, I understand that there was a gap in the perception of how it was being received. And so we wanted to be exceedingly clear that parents are the authority. We've never been far apart on that. We all agree and have always agreed that parents are the authority on medical decision-making for children. And so we wanted to take the pause to make sure that our marketing materials and our forward-facing documents reflected such. I believe your last question had to do with Chairman Reagan and his vaccination status. The bottom line here is that you don't have to trust the government. You don't have to trust me or the governor or elected officials. You need to trust those voices which matter to you as an individual. For a lot of people, that is their doctor. For some people, that is their clergy. For some people, that is their family and friends. I've been very clear all along. I think people should be vaccinated. My entire family, including my children, are vaccinated. I encourage Tennesseans to do that. But at the end of the day, it is a personal choice for the individual. And it's not the role of government to coerce or to bully or to shame people for making a choice that they feel is best for them. It is our job to educate and encourage and make it accessible and then stop.
Thank you, Dr. Piercy. But what I really was wondering is, would it help? We're seeing numbers go up. Would it help? Because a lot of people, it seems like politics is interfering with science. So will you think it'll help the numbers here in Tennessee if lawmakers come out and say, yes, I've been vaccinated? Do you think that would help Tennesseans get the COVID-19 vaccine? Thank you.
Sure, and that's a fair question. The answer is, I think anybody who wants to share their personal story and say, here is why I did it, and here's why I think you should do, why you should do it, is helpful. And I don't want to pivot too hard, but it just reminds me of this Our Voices campaign that we launched a few weeks ago, which is particularly amongst Black and Brown communities, where people are saying, hey, I understand you might have questions, and I understand you might be hesitant. That's okay. And I was a little hesitant too, talking about these Our Voices stories, but here's why I chose to do it. Those are the messages, whether it's from lawmakers or family and friends or your next door neighbor, those are the messages that really resonate with people is, here's my story, and I think you should listen to.
Thank you. Next question is to Blake Farmer with WPLN. Blake?
I'm going to try really hard to make this one question, but I just want to make sure I understand what it is you all have scaled back, because there was some mention of like not doing school-based vaccination events. I don't know if there were some that were planned that actually were canceled, or you're just not going to do them anymore. And I just want to make sure I understand if this applies to the urban departments. Like, are they not going to be allowed to vaccinate without, under the mature minor doctrine, or hold vaccine events at schools?
Thanks, Blake. I do think that was two questions in one, but I'll try to get to both of them. So the first one is about what was the pause about? The pause was about making sure that all of our materials, and we're talking about postcard reminders, flyers that go home in registration packets, consent forms, all of the things that deal with childhood immunizations, that they were appropriately directed at parents and not kids. There are a lot of moving parts and pieces right now about back to school events, and we are bumping right up against the start of the new school year. And so we're trying to do that as quickly as possible. And as far as I'm concerned, I think we've gotten pretty much all of that done. We've got events with schools as soon as Monday and Tuesday of next week. And so that's what that was about. I am unaware of any straight up canceled events. There might have been some that had to be pushed out a little bit because of that pause. But we tried to do that very quickly so we didn't cause any disruption. And the second question, I told you I was going to forget. Remind me the second part of your question again.
And I just to follow up there, you're saying that it's not that you all are going to stop doing vaccine events. You paused, and now you probably are planning, you're doing vaccine events, back to school vaccine events at schools where the COVID vaccine would be offered. Is that correct?
That's right. Yes, we have some.
Great.
I know Sumner County has one on Monday and Tuesday. Yep. I think maybe Granger County and others. And I do recall the second part of your question now, which is about metro health departments. Right. And I know it's confusing to people. We've talked about this for a year and a half now. The State Department of Health has direct purview over the 89 rural health departments. For the 6 metro health departments, they function as part of their county government. They are related to us mostly as it pertains to financing and funding. I like to personally think about it sort of like a joint venture. So we have some support, but we don't have direct operational control. My message to those 6 metro health departments would be for them to re-examine their materials to make sure they are also appropriately targeting adults and not children.
But this issue of vaccinating, 14 and up without parental consent, I know that it's really rare. But are you all telling folks, do not do this?
We are not telling them not to do that. We only have control over what we do in our 89 rural health departments. And the mature minor doctrine, it is my understanding, is still applicable in Tennessee. And that would pertain to all providers, not just the Department of Health.
And you're saying your 89 counties are stopping or not on the 14 and up mature minor doctrine?
That's a good clarification that I'm glad you brought up, because Chairman Roberts and I had a pretty extended conversation about that yesterday. And his comments in the committee meeting a couple of days ago were pretty broad and general in that we're not going to be pursuing that. He does understand, and we had this very explicit conversation yesterday and are completely aligned on this, that there are very nuanced and fringe situations where that might occur, and none of us want to get in the way of that. As you've already mentioned, they're pretty rare. You know, a month ago when I talked about this, it was in the single digits, and given the fact that most of these are done most vaccines are done outside of health departments now, I think the number is still really, really low. But to be clear, we are still operating under that policy. We just understand that it was for very fringe and nuanced cases.
Thank you. Next up is Jonathan Mattice with AP. Jonathan, if you can unmute your microphone, please.
Hey, Dr. Piercy. Going off of what Blake was asking about, are there specific outreach measures that are not going to be resumed from this pause? Can you talk about sort of what exactly has been stopped? I would think, the social media campaign and those things that were directly brought up by lawmakers, that sort of thing.
Sure. Yeah, that's a good question, Jonathan. The broad answer to your question is nothing has been stopped permanently. So we put a pause on many things, and then we have resumed all of those. The things that I guess if you want to say were permanent changes, we did take down 11 social media posts that depicted a child without a parent. You will see us do advertising and marketing in the future that contain children, because we still think it's very important. But going forward, they will have references to parents, maybe pictures of families and parents. That's the only thing that we have stopped permanently, is that single focus on child social media, the advertisements that were held up in the committee hearing. Everything else was paused and is now resumed.
And just following up again on Blake's question, so there would be some circumstances where the county health departments could use the mature minor doctrine in rare cases. I'm just trying to get, more clarification on how that would work.
Yes, that is correct. We all recognize, including Chairman Roberts, as of yesterday when I talked to him, and the governor as well, we do recognize there are some very unique situations where there are older teenagers that might be in social situations that don't allow them to have parents come in with them for one reason or the other. So we will be able to continue servicing them under the mature minor doctrine.
Thank you.
All right. Thank you, everyone. That concludes our time for today. Thank you for joining us, and hope you have a great rest of the Friday. Thank you.